You have to ignore this and just use the pool.
Okay, this time I'm going to be doing a mini bag as the primary. So the first thing I'm going to do is I'm going to check my doctor's orders and see what the medication is. And the medication that has been ordered is 500 milligrams of vancomycin. I will gather my supplies. I have my primary line,
Yeah, that's fine. That's fine.
my
We'll do that.
bag that I'm going to mix my medication with, because vancomycin needs to be mixed with the 0.9% sodium chloride solution. My flush, my draw-up needle, my alcohol swabs, my gloves, my Vanco, my saline solution that I've drawn up my flush with, and I have my labels for my bag and my tubing once I'm done. So I would calculate my drop factor. So 500 milligrams of vancomycin and my vial, once I check it, for the appropriate medication and expiration date, I see that it is 250 milligrams per milliliter. So I'm going to need 2 milliliters of this. So I will clean this. Top of that. Draw up 2 milliliters of air. Inject. Draw up my 2 milliliters of medication. Single-handed scoop. Verify this is 2 milliliters of vancomycin against my MAR, and I'm going to in my bag and inject my medication into my bag. I would put this into the sharps box. I'm going to apply my label, which is going to have the name of the medication, patient's name, the dosage, the route, the date, time, my initials. So it's in a 100 milliliter bag, so we can add the 2 milliliters that we've injected into it, and that is 102 milliliters divided by how long it needs to run, which we could verify that in our Davis Drug Guide. It will run over the course of an hour, so that's 60 minutes, multiplied by the drop factor that's on the bag, which is 10 drops a minute, and this is going to run at 17 drops a minute. So we can, once we hang it, we can adjust our roller clamp to make sure that it's running at 17 drops a minute once we get into the room. So I have all of my supplies prepped, my label for my IV line, okay, so when I enter the patient's room, I'm going to do hand hygiene, provide for privacy, verify my patient's name and date of birth. I'm going to assess the IV site. I'm going to check the patient's chart and ask the patient if they have any allergies. I'm going to inform the patient that the doctor has ordered IV vancomycin, and ask them if they have any questions about the medication before we administer it. And I'm going to spike my bag. And I would hold the line over a trash can and open the roller clamp. I need to fill the drip chamber 1/2 to 1/3 of the way full. Open the roller clamp to prime the line. Once we have the line primed, then we can hang this here while we perform the ASASH technique. Aspirate, saline, administer saline, and heparin. We would only administer heparin if there is a doctor's order for that. So I'm going to clean my patient's IV port.
They have more equipment over there for some reason.
And initially, I will aspirate and administer 3 milliliters flush. Install my line. And open the roller clamp. I'm going to be monitoring my patient for any reaction to the antibiotic, and then once it's time for the antibiotic to be up, I would come back in, re-hand hygiene, new gloves,
down the pole.
and I will
had removed this one
remove
and place
this,
it on the floor.
and I'm going to put a cap on this. Oh, I've got to close our roller clamp. I'm going to put a cap on this so we can save it and possibly use it later. And then I'm going to reflush the line. And I'm going to document the medication. Vancomycin, 500 milligrams, mixed into 100 milliliters of 0.9% sodium chloride solution. It was administered via IV, the date, the time, how well the patient tolerated it, and my initials.